Hello you guys, welcome to this week's Wellness Wednesday. Today I kind of wanted to go back to my roots here a little bit on chiropractic, as I am a chiropractor. Shocker. I know we've talked about a lot of different topics, but one big thing that I wanted to talk about is chiropractic safe in pregnancy? And I wanted to bring this up because this is a question that I've actually had come up a few times here recently, where patients have either found out that they're pregnant and they want to know if it's safe, or people have or that I've encountered have found out that they're pregnant and they would like to get care because they're sore or stiff or they've got certain complaints, but they're not sure if it's something that they're able to undergo while pregnant. And so I wanted to address this, as well as what some of these kind of fears or some of this misinformation out there is, because chiropractic is, for the most part, perfectly safe with pregnancy. And the reason I even say for the most part is because we just do some small modifications in how we treat. The same way that I would do a modification if I'm treating someone who's 2 months old versus someone who's 20 years old versus someone who's 90 years old. Every patient that walks through the door is treated as an individual, not someone out of a textbook. And being pregnant is just like that. It makes you an individual that we treat based on your current state, your current condition. So some of these modifications, I mean, the most obvious that people say is, as a chiropractor, or whenever you go to a chiropractor, you always lay face down. Well, when someone's pregnant, they can't lay face down. One, we have ways that you can lay face down. We can either prop you up with pillows. We have certain tables that can drop down so that you actually can comfortably lay face down with still having a belly growing. And it's always a little fantastic because by the time that a lot of expecting mothers get to the point where they're 7-8 months pregnant, they haven't been able to lay face down for a really long time. So they kind of love that moment where they're like, oh, this pressure is just off. So that's actually one thing that we can do based on the tools that we've got to put that position, or to create that position as an available resource. The other options that we've got are not adjusting with the patient face down. We can actually do our adjustments with patients in alternate positions, whether it's face up, or on your side, things like that. So not everything is always just a face down thing. So having the belly is not always going to be a hindrance. And I know that's one of the big fears that's out there. Another thing that I always like to address too is there's always the fear that, okay, well, if we do an adjustment, it's going to actually hurt the baby. And that's just blatantly, there's nothing that I could do that's really going to be interfering with that. I know that when we do treatments like physiotherapies, like electric muscle stim and things like that, we typically will not be doing any of that over the low back or anything like that, not because we think that there's going to be any damage that would be done to the unborn child. There's just no research, and so we don't do it because there's no research to back it up, so there's no safety precautions for it, so we don't do it. It's not recommended to do because no one wants to say, hey, I volunteer to see what happens. There's an understanding that it would be shocking that anything would happen, but again, nobody wants to volunteer and say, hey, let's just see what happens if we put stim on my low back while I'm pregnant. And so it's just a known thing that we don't use electric muscle therapy or electric muscle stimulation with someone who's pregnant in their lower back region or anywhere near over where the baby would be, especially over the tummy region too. That would be another big thing. So these are some of the common things that people have questions about. Another big thing that I like to address as well is anytime someone comes in and we're looking at like a muscle therapy, we always want to make sure that we're aware of where we're doing the muscle therapies. I know there's questions on even like massage therapy with pregnancy, and a lot of that has to do with how our body reacts with muscle therapies. So there's certain like acupressure points like in our hands or in our adductors, which are the insides of our thighs, or even like in our ankles or in our feet. And if we hit those certain points or hit those certain areas, our body will naturally release oxytocin. And oxytocin is a hormone that's actually going to induce contractions. So for some individuals, that could actually cause a miscarriage or cause early labor. And so with this, we want to make sure that if we're going to be doing any form of muscle therapy, whether it's trigger point therapy, active release techniques, anything like that, or even a full massage, that we're making sure that we're staying away from these areas that could be triggering a release of oxytocin. But again, if you're working with a provider who knows what they're doing, who's aware of these things, it's really a no big deal. You can actually get so many benefits because with chiropractic, we're actually taking pressure off of the nervous system so that you can function optimally, because anyone who's been pregnant knows that it's not exactly an easy task to be, growing a human. And so creating maximum space for the pelvis to be moving freely, especially once you get to the point where your pelvis starts to relax for delivery. Most women notice that their low back, that lumbar curve starts to accentuate more than it was actually built to do. So actually making sure that we create the effective mobility in those joints and actually work on strengthening through there too is huge, so that you don't get too much of a curve and have long-term damage to try and recover from. Things like that are really helpful. Changes in the rest of the body, like adding extra stress to the neck and shoulders, is also really important to address through pregnancy and then after delivery, because a lot of moms will notice that they're looking down a lot more, especially after delivery. So if we can take a lot of that back and take a lot of that stress off, that's fantastically helpful. And then as we get later on into the pregnancy and we start noticing round ligament pain, and for anyone who doesn't know what that is, our round ligaments are basically the ligaments that suspend the uterus into space. And just like any other tendon or ligament or anything like that in the body, if they get wound up, the space in the uterus is going to get smaller, and as that baby grows, having less space in there is not a good thing. And so being able to do trigger point work into the round ligament to release that so that uterus can actually have more room, it's more comfortable for mom, it's more comfortable for baby, and that's something that we can do right in the office. And it's all non-invasive work. So making sure that we're keeping the entire hip girdle, the entire low back, all of that region working and moving freely, so that both mom and baby have the best opportunity for the best pregnancy as possible, is actually a huge, huge success and a huge opportunity, as opposed to this fear that we could do damage. Again, just make sure that you're working with someone who knows what they're doing. If you have questions or concerns, obviously reach out to myself, to your OB, to a PT, to your chiro, to whoever, but make sure that you're getting yourself educated, because there's so many fears and opinions out there, but make sure that you're making the best decision for yourself. So I hope you guys have a great week, and we'll catch up next week. Bye.